Now it's time to do something we've never done here before. Watch a short movie. I'm proud to acknowledge my daughter as the filmmaker who came home from her world travels this fall to visit programs with us and tell the stories she heard as we met with youth, from second graders to young adults, their families, and those who care for them. Some of the stars of our short film are here with us tonight. I'd like to ask these partners to stand up and acknowledge our friends at On Our Own. Where are they? Our friends at Sarah's House, I believe they are here. And Phil and Maria and Catholic Charities. I believe we have some guests from there as well. Thank you all for donating your time, sharing your thoughts and ideas, and for inspiring us. It means a lot. Thank you. And now, I think we are on with the show.
There needs to be a change. I mean, that's obvious. Things that are the way they are now is not working.
Like, some people can't even take care of themselves. We got people out here that's homeless.
We lose a lot of people in this world that don't have help. It's every day. It's not just one day. It's every day.
Sometimes people can hide their problems and like take it out on other people or things, like do drugs and stuff.
Our kids are struggling, and it's important for them to get the help that they need or that they don't even know that they need.
There are youth and there are people that are getting a start in life, and they're automatically starting on the wrong path because there are things that aren't accessible to them.
I'm going to ask you what Villa does for you.
Okay, go ahead.
We do a lot of work and we get smarter. So we do math and homework. Calm down. And when we get in trouble, we do belly breaths and breathe in and breathe out. And it helps us not get into fights like each day. That's it.
That's it. His temper has definitely changed. He's had a big change in his temper. Before he started services here, he was
A mess.
awful. And a lot of people, if they first met him and did not know about him, you know, their first reaction is, oh, he's a bad kid. But since I started and actually learned more about his disability, like through services and PRP and things like that, now I know more what to do with him.
I know we have a lot of mental health centers around Maryland, but it seems like we need more resources for more workers in those agencies. If you have 50 agencies, but only about 2 workers in each of them, it's kind of hard to deliver the services you need to.
We need more resources. We need more. I find it every day, like I'm working and I work with great people and we do awesome stuff for the kids. And then there's this in-between like of outpatient and inpatient. But the space in between, that's where we have some resources, but they're spread thin.
If we had early education and if we had resources given to people at a younger age, then they would know where to start. They would know what the next step is. But until we have access to provide this kind of education for the youth, we're going to be in this cycle, this constant cycle of in and out of rehabs, in and out of institutions, struggling with homelessness, and all of this is going to continue unless we do something different.
One of the major things that makes a difference in youth lives is being able to have a place where they feel seen and heard.
I think one of the most important beneficial factors to the youth population would be making sure that everyone's heard.
Sometimes I can say what I've seen in my line of work and also my own recovery, that sometimes those who are helping or offering services try to force their own agenda or own opinion on the person that they're working with.
I've been told when I was in the hospital that I wouldn't return to a normal baseline. I was so sick that I would never return to a normal baseline. I've been told that I don't have any value. I've been told I'd never be able to go off meds. I'm now in remission, so I'm med-free and I take really good care of myself.
I am of the belief that people are the experts in their own lives, and so we can all use help from one another and assistance from one another, but your lived experience is what you know best.
Older people, we come from this evolved place of education, some cases experience, and so we forget that, some of the issues and barriers that we had. And so what we want to do is we want to, open up and allow, give our young people voice and choice.
I would love if in Maryland we would invite youth to more of the decision making, especially when it comes to policy and advocacy. I think a lot of times they create the programs and then they bring in the youth and they're like, oh, let's hear your opinions on things. But I think there's a lot of value if you bring youth in the beginning in the infrastructure of these programs, because they know what they want, they know what they need.
The older generation tends to talk about mental health or have a stigma for it because it seems as invisible or that we don't need it, but it affects every aspect of your life.
Without a stable mind, you can't have a stable body.
I struggled with mental health starting in like 7th or 8th grade. The lady I talked to, she helped me out a lot. I felt like I really got something out of it, and I never would have thought I would because I never really believed in it. I was like, I don't want to do no therapy. Like, I'm fine. That's how I thought of it until I actually talked to someone and she understood where I was coming from.
I talk about basketball with my therapist and how to control my anger and what to do when I'm angry.
Has it helped?
Yeah, it helped.
Do you think that it's important to have youth involved with mental health?
Yes, because there's a lot of reasons why some of the youth do what they do out here, because they don't have no one to turn to.
I'm in college. We have like health centers and you have a counseling center, but like to the average person who isn't in school, you would have to like pay a lot of money just to see and talk to somebody.
If you had $1 million, what would you do to help kids like yourself?
Some people I know, they have trouble getting to places and like from places. So like I would help them like try to get maybe like a vehicle maybe. Oh, another one like that. So some some people can't get to and from places, maybe if they like have school, maybe like they can have therapists at school.
I know schools, we have, counselors and things. It's not really like, let's everybody go talk to the counselor. Like, there's not really like mental exams for children or anything that I think there should be.
What changes would you like to see happen here?
Maybe not so much like more therapists going in and out, because I've had a lot of therapists and I can tell like it's hard for some people to open up to like new people.
If you could change anything about Villa, what would you change?
More rooms and more chairs.
Why more rooms?
So it can be more people.
Why do you think students need to come here?
Because some more people got ADHD.
If you had $1 million, what would you do to help kids like you?
Get some new students.
Yeah, why do you want new students?
Because there's only a little bit of people there.
Yeah, and why do you think this place needs more?
In a way, everybody can have their own therapist.
Why do you think that's important?
The way everybody don't be fighting and cussing and destroying stuff.
All right, you got 3 wishes.
Fidgets. Safe places. And a stress ball. I have $1 million. It
it wouldn't be enough because like it's a lot of kids like me, and I would like try to help them with their biggest problem and like try to get kids into better schools and help them with expressing their feelings. So when they grow up, they don't like think that nobody cares.
If I could speak to the lawmakers about what changes I would like to see in mental health, I would ask for more of a way for our voices to be heard.
At the end of the day, people who are making the decisions are not the ones actually going through the different trials and tribulations and the trauma that is involved. And I think we need to be mindful that lived experience is valuable and it should be at the forefront. And when somebody speaks up and they tell you what they want, which is such a brave thing to do, to stand in your own, to stand in your autonomy and be like, no, this is how I want to be treated. This is where I want to go. This is the medicine I want to take. This is how I feel in my body. It takes a lot to be able to do that.
I don't believe that we should tear the system down that currently exists. I'm just asking to carve out some space for something new and innovative.
I don't want to be a cliche, but again, you know, they say the youth is the future. If you don't make sure that the foundation is solid, the whole building can collapse. So if you don't make that effort to make sure that the youth have solid mental health or solid overall well-being, where's the future going to be? Where is their individual, our whole future going to be?
Anything else you want to say?
Yes. And we're on your kids. We can do this. Hold on.
And now it is my distinct pleasure to introduce a very special guest who's with us, a champion of mental health herself, a longtime public servant who championed STEM education, working families, survivors of domestic abuse and the environment during her time in the General Assembly, and the first woman of color and immigrant elected to statewide office in Maryland. Please join me in a rousing welcome for our Lieutenant Governor, Aruna Miller.
Good evening, everyone. Was that an astounding video or what? Isn't it beautiful to hear from the voices of our children? Linda, I want to say congratulations to your daughter for putting such a profound video out for all of us to share about the importance of mental health and how it affects every one of us, from those that are in elementary school all the way through adults. And the most important lesson that I learned from this video is that we need to hear from those that are going through the lived experiences, right? And this is something Governor Moore and I and our entire administration so much believes in, that those closest to the challenge are closest to the solution. And that's why we've been going around the state during this whole past year and every single day to meet Marylanders where they are, to understand what their concerns are. So it is great to be here with every one of you, advocates, and so many others that have come together to really make a difference when it comes to mental health. So I know events like these are not easy to do. There's a lot of individuals that make events like this possible. So let me just first recognize Linda Raines, CEO of Mental Health Association of Maryland, for her extraordinary leadership here. Now, I looked at Google and learned that this is the second oldest mental health advocacy group in the nation. Is that right, Linda? Wow, that's pretty incredible. And so you've been steering the ship this whole time, so thank you. With others. Dan Martin, thank you for your leadership as well. To all the elected officials that are here, and I just saw my friend, Delegate Heather Bagnell. Is she still here? Well, yes, but I do want to say how very proud I am of her that she was recognized as one of the award recipients for today, and she does an incredible job. And if any of you ever follow Twitter, you should follow Delegate Bagnell. Talk about in ways in which she lifts people up every day. She's the one legislator I know who posts whenever it's somebody else's birthday on her Twitter feed. I mean, I've never seen anybody do that, but I gotta tell you, that is so uplifting for that individual and for others to see that as well, that she puts other people ahead of herself. Imagine that. So I really appreciate that. And to many of the advocates, providers, and behavioral health professionals that are here today. I extend my deepest gratitude to every one of you for your tireless efforts in improving the lives of Marylanders that are facing when it comes to mental health and substance use disorders. As I said, not just to Delegate Heather Bagnell, but to hearty congratulations to all the award recipients this evening. Thank you for your work and advocacy. And at the Moore Miller administration, we have some pretty extraordinary, talented, and compassionate leaders who are working at the state level to ensure the well-being of all Marylanders. Let me just take a moment and a source of pride to recognize some of them. I'm not sure if they're all here, but Secretary Beatty, thank you for your leadership. Secretary Laura Herrera Scott, Secretary Rafael Lopez, Secretary Vinnie Schiraldi, Secretary Carmel Rose, and Deputy Secretary Alyssa Lord, and Deputy Secretary Ryan Moran, and Special Secretary Emily Keller. I saw, there she is, yes. So we love to brag about our extraordinary leaders. It's going to take all of us working together in partnership to integrate mental health policy into public health policy, education policy, economic policy, and our social policy. Here's the thing. None of us get to decide when we're born our race, our gender, our abilities, or our socioeconomic background. And that's why it's essential for those of us blessed with opportunities by chance that we have a profound and moral obligation and duty to fight for those who have been left behind and marginalized, and to see to it that every child deserves equal opportunities to succeed, regardless of the circumstances for which they are born into. Which is why Governor Moore and I have been clear from the get-go where our focus is to uplift every child in Maryland so they can live their authentic lives and reach their full potential. And together with each of you, we are tackling systemic socioeconomic challenges each and every single day and moving the needle towards lifting Maryland families. Last year, together in partnership with the Maryland General Assembly, we permanently extended and expanded earned income tax credit and expanded child tax credit, which benefited over 160,000 Maryland children. And under Secretary Lopez's leadership, crucial SNAP benefits have been restored to thousands of Maryland families. And Secretary Herrera Scott and her team helped safeguard Medicaid coverage for over 5,000 at-risk children. And just last month, we announced the Governor's Office of Children under the talented leadership of Special Secretary Carmel Martin. Last Wednesday, Governor Moore delivered the State of the State address, where he articulated our vision from Maryland. But you know where this vision came from? From Marylanders. And this vision can only be accomplished through partnership. Partnership from the executive branch, the Moore-Miller administration, our legislature, our advocates, nonprofit organizations, corporations, and most importantly, the community itself. Because Governor Moore stated that partnership doesn't keep score. Partnership has no ego. And partnership isn't partisan. Partnership is how we're going to build a state where we leave no one behind. A state that is safer, more affordable, more competitive, and equitable, and a state that continues to serve. The State of the State is our vision. And I'm not sure if you heard, but the governor also did the state plan. So the state plan is how we're going to implement this vision for the next 3 years through 10 priorities with objectives and key performance indicators. So this is what you all get to measure, whether the Moore-Miller administration is really living up to the vision that we set forward. Look, there were a lot of people that said, you know, Governor, you may not want to do that. Why would you want to put yourself out there? Because what if you don't meet those objectives? But here's the thing. The governor knows it's important for us to be as transparent as possible. And you, the public, have to let us know whether we're doing a good job or we're not. We want you at the table. We want you looking at the material that we're going to be putting out there for you to review. And let us know if there are other things that we need to be doing. Maryland has the second highest median household income in the country, but 1 in 8 of our children live in poverty. We refuse to accept child poverty as inevitable in Maryland. I don't need to tell any one of you here that when a child grows up in impoverished conditions, it can significantly impact their well-being and their development. Mental health inequities shows up everywhere throughout the state, from Western Maryland to Baltimore City to suburbia in Prince George's County to the Eastern Shore. So it's from rural areas, suburban areas, urban areas. It doesn't discriminate. Children of all ages, even as young as infants, face mental health challenges. 50% of lifetime cases of mental illness begin by age of 14. I'm sure all of you know that already. 90% of self-harm starts in adolescence, also around the age of 14. And as of 2022, 13% of children and teens in Maryland have anxiety or depression. That's a 30% increase from 2016. And I know each and every one of you has felt this increase in the work that you do. You've heard it from students, you've heard it from parents, you heard it from educators and counselors, and I've heard it too. As I travel around the state, visiting schools, and I visited many, many schools, including Rising Sun High School in Cecil County, Elizabeth Seton High School in Prince George's County, Annapolis High School, in Anne Arundel County. And the students are so generous in sharing their stories and their vulnerabilities. And they say that vulnerability is the last thing we want to show in ourselves to others, but it's really the first way in which other people feel connected to you. That's why it's important to share our stories. I also traveled with Secretary Emily Keller and her team to a series of community town halls across the state related to substance use epidemic, and we heard their stories, their struggles. Each of us have those same stories and struggles, and the more we talk about it, the more we can bring sunlight to this issue and remove the stigma that's associated with it, which is why one of the reasons I've taken it on to share my own family's mental health struggles that we face. I came to this country as an immigrant, my whole family did, from India. My mom and dad gave up everything that they knew in the country to come to a country where they didn't know anyone, no one spoke their language, or ate the kind of food that they were accustomed to. My dad struggled to raise a family on his salary as an engineer. But what we didn't know was my dad was suffering from bipolar disorder almost his entire life. And back then, nobody ever talked about it. So we just watched my dad and his kind of bizarre behavior. He would be the most charismatic person you could imagine during the best of his days. And during the worst of his days, he wouldn't talk to anyone and mostly just sleep. And as a result of that, he ended up losing his job because he didn't show up to work when he suffered from the downside of bipolar. When you lose your job, you lose your friends. You lose your social network. And in doing so, he lost his dignity in many ways. And I'll never forget my dad going through that. And once he learned what it is that he was suffering from and he sought treatment, it was a little late by then, but nonetheless, it helped him. But he suffered a lot from it, and so did his whole family around him. And that's why what is happening here with all of you and that beautiful video of young people to coming forward and talking about their own mental health struggles is so critical to really getting them on the path to road to recovery. And so I just want to say thank you for everything that you all are doing. I'm glad we live in a different time where people are feeling more comfortable to talk about their own stories. So it's important for people living with mental health conditions to know that they're not alone. The stories can set them free, help others with similar experiences, and help all of us in a room to help in their road to recovery. The video, again, was really powerful to bring forth the voices that need to be heard and the stories that need to be told. So to everyone in this room today, know that Governor Moore and I, we hear you, we see you, and we are here to support you in partnership to create safe, inclusive, and supportive spaces where people can share their stories without fear of judgment and stigma. Let us continue to create these spaces and bring everyone to the table. We need more providers from rural Maryland at the table. We need more Marylanders who are involved in harm reduction at the table. We need more students at the table, and we need more Marylanders who work directly in communities with our young people at the table. And we need each and every one of you. This is a complex issue. We're not going to be able to resolve it overnight. I always say the road to progress is always under construction. And so the road to progress to make sure we get a healthy Marylander and make sure their mental health and their well-being is a priority. We're going to need all of us, and we're going to have to do it each and every single day. So thank you for inviting me to speak, and again, thank you for everything that you do.
Well, on behalf of all of us, Lieutenant Governor Miller, thank you so much for your sharing with us and for your remarks and for all the work we're going to get done together as a community.
We already know that we are a little bit behind the 8 ball because of schedule changes, but we're going to do the best that we can in terms of covering the important topics. So I'm going to start out by asking our distinguished guest to, rather than doing a formal introduction, I'd like to hear from each of you to tell us about what brought you to this leadership role in Maryland. So let's start with that. Yeah, you want to go in that order? That's fine,
sure.
Sir.
Hi, my name is Vinny Schiraldi. I'm Secretary of the Department of Juvenile Services. I've been in this field 44 years now. I started as a house parent in a group home. And I think what brought me to that was just my neighborhood. A lot of kids got arrested, and we saw that when they went to juvie, they always kind of came out worse. And we always respected them more for that. Like they had cred. So I thought there's got to be a better way. And so 44 years ago, I started in this field. I've been in it for a long time. I've run a bunch of different agencies. I knew of Governor Moore's work when I was running the probation department in New York City, and he was the head of the Robin Hood Foundation, which did absolutely fantastic work. We interacted a couple of times. When he got the job, I was just super excited and sent my resume literally over the portal and got the call. The 44 years I've been involved in this field have sort of gone in lockstep with mass incarceration and consignment of a lot of adults and kids, mostly young, mostly black, mostly male, to facilities and prisons and juvenile systems that make them worse. And so my career has been devoted to pushing back against that and trying to have kids thrive in communities rather than languish in correctional facilities.
Thank you.
Hi, I'm Laura Herrera-Scott. I'm the Secretary of Health. I'm here to serve. First person to go to college in my family, first doctor in the family, and I certainly have thought of public service as my opportunity to give back to the communities where I live and work. I was in public service most of my career. That includes at the federal, state, local. It also includes some time in the military. I went to the other side for a little while and saw the light again and came back. And as I was watching the work that Governor Moore and Lt. Governor Miller were doing in their campaign, said I wanted to be a part of that team, and am incredibly grateful and thankful to be in this role.
Thank you.
Good evening, everyone. Is this working? Here, never mind, I'll just switch. There we go. All right. Oh, I didn't see it. There we go. Thank you. I learn something from my sister every single day. I'm Rafael Lopez. I serve as the Secretary of the Department of Human Services. And very similar to my colleague, I'm the first in my family to do lots of things. Graduated from high school, college, and graduate school. But what brought me to this work was my own lived experiences. There isn't a single thing that I've worked on in my career that I didn't personally experience or watch my own family or extended family struggle with. And that has been a calling and a joy to serve, because I will never forget what it felt like to have my family not treated with respect and dignity. And I told myself as a child bearing witness to that, that if I ever had the opportunity to change things, I would, and that I would do so with a very different lens, because the people we serve are already beautiful and brilliant and full of potential.
Thank you.
I hate following Raphael. Just keep.
Just going to say, don't follow Raphael. That's the bad seat.
I'm Carmel Martin. I am the newly appointed Special Secretary for the Governor's Office for Children. So really excited to be with you all here today. I'm a also first-generation American and first-generation college grad as well. And I've spent the last 25 years, not quite as long as Vinny, working on public policy. I've covered a lot of different policy issues. My most recent position was with the Vice President Kamala Harris, being her domestic policy advisor. So I kind of had to run the gamut of domestic policy. But the issues that I've spent the most time on are those that relate to supporting children and families, and particularly tackling poverty. So thrilled to be working under the leadership of Governor Moore and Lieutenant Governor Miller, tackling child poverty here, and working with my colleagues to tackle child poverty here in Maryland. So thank you.
Okay, I know my role does not permit me to make editorial comments, but I'm biting my tongue and I want you to understand that. Next question is, you had an opportunity to see this film this evening, and would you be willing to just share your thoughts about what some of the youth and folks who are in this audience had to say?
We doing the same thing?
If you want to do that, that's fine.
I mean, I found it inspiring. I think that every time I listen to kids, I'm a better person for it. And I spend a lot of time in my facilities just talking to young people. And I think the more that they can engage and have their own voice and have their own agency, the better we all are, and the better our work will be, and the more successful we'll be, and the more successful they'll be. I think our bureaucracies are often set up to avoid that and to sort of stultify that, and that's to our detriment. I think by the time we get to be high-level bureaucrats, we think we're supposed to know a whole bunch of stuff, so that we should listen less, you know? And I find that to just be a really destructive approach. I don't think that there's enough young people's voices out there, and therefore they get stereotyped, you know, like they are right now. I want to say, like, the coverage of kids in Maryland, you would think they're a plague from watching the evening news, and they're not a plague, they're our future. And that, I don't mean that as a hackneyed phrase. They're a group of people with a lot of assets and a lot of potential, and if we talk about them as if they're super predators, we're going to squelch their hope, and then they'll find their ways into our prisons and our morgues. And too many of them are doing that now, and we need to step up, otherwise it's going to continue.
Thank you.
So I took some notes while I was watching, and Linda, don't be mad at me. So I thought it was interesting that the opening of the video was, there needs to be a change. The way things are now is not working. And I've been in the role advocating for lots of change, because we have a system that doesn't serve anyone as well as it could, especially children. And you know, certainly my takeaway, I mean, first of all, I think it was mentioned in the video about the bravery for those kids to talk about what they're going through and what their needs are, and even listening about what they would do with $1 million, and hearing how they would reinvest it into the system that's serving them to serve more kids. That was really profound, even at their age. But I think to Vinny's point, you know, we focus on what's wrong with children and adolescents instead of what happened to them to make them act out the way they act out. And we absolutely need to change that paradigm and start really understanding what is happening to our children that makes them behave. And to your point, so they don't get on this path in school that makes them the bad kids, or sends them to the principal's office, or suspension, or worse yet, get them kicked out of school, that then really becomes a downhill trajectory. And I think you heard Alyssa Lord and Dr. Moran earlier talk about all the things that we are doing with Medicaid and MCHIP premiums and redeterminations and our behavioral health continuum of care. But we absolutely need to go upstream and start addressing early childhood trauma and some of the exposures that our kids have by virtue of where they live or what they've seen, and start addressing that. And I think these kids
and their behaviors and what they were talking about alluded to that journey that we need to really, really be on.
Raphael's going to let me go first, so I don't have to follow him again. But I thought the film was incredible, and it is just how children really do have so many of the answers if we just take the time to listen to them and talk to them. I spent the morning in Cambridge, Maryland with the governor, and we did a small round table after an event we did there, and there were not quite as small as the kids in the video, but there was a high school student and 2 college students who had the most insightful comments in the round table came from them. And interestingly, unprompted, both the 2 college students and the high school student talked about the need for support for mental health and the importance of, they didn't use this terminology, but social emotional learning as part of our education system. So the video was truly inspiring, but these kids that I got to be in the same room with were even more inspiring. And I just think it's about supporting children who have experienced trauma, but also I think that what there's a growing awareness about is that all children really need us to be cognizant of their mental health needs and education. We're not going to get to academic success if we're not attentive to social emotional learning, which I think is something that we knew, but COVID helped bring home. I think more and more parents saw the impact of schools and our education system on the social emotional development of children. So I was thinking about that as I was watching the video.
I was taking notes as well when I was watching the video because it struck me that it shouldn't be innovative to actually engage the very people in whose names we serve. And I was looking for a quote that the governor recently shared, because it's always inspirational to quote our boss, who's really good. And he said, "We owe it to our people to disrupt the patterns that drive pain, hardship, and tragedy. And we owe it to our state to unlock the promise of our children and communities." And in my role as Secretary of Human Services, one of the many things for which we are responsible is the 3,792 children today in the care and custody of the state of Maryland. And we need to say out loud here how the state of Maryland for years has squandered and left on the table federal money to be drawn down to prevent a lot of the trauma and tragedy of which we speak. Specifically, since the 2018, when the Family First Prevention and Services Act came into law, the state of Maryland has drawn down $0. Zero. And we were having to rebuild an infrastructure because that federal money, in partnership with state general funds, allows us to invest when the problem happens early on so that our kids don't have to end up in our systems, do not have to end up in correctional facilities, do not have to require the kinds of very high-end restrictive placements that we have come to accept as normal. And so I want to, no, yeah, it's fine. I say this because when I think about the video, we have been trying to turn around the culture at our department and in the state of Maryland that has allowed this state to lead in another area, and not one that we should be proud of, but one that we're tackling, which is a number of young people who age out of foster care in the state of Maryland. When we compare ourselves to our sister states right around us, it's sometimes double, triple, or even higher than that. And we are double the national average. That means 18, 19, 20, and 21-year-olds who should be on their way to thriving, we let age out with sometimes not a job, not a house, not a place to call family, and not those who are kin, by blood or by choice. And so one of the things that I thought of in the movie was that that's not okay. Right. We shouldn't make it so innovative to talk to young people. It should be the way we do things. And modeling that with this administration is a culture shift in a dramatic and intent and a purposeful way.
Wow. Okay.
I feel like we could tear up the questions, Edgar.
I know, and just let them talk. I mean, it'd be fine.
Yeah. So my name is Jane Walker. I'm on the board of the Mental Health Association, a parent and an advocate. So it's very clear that based on your comments and having read your biographies, you're incredible, every one of you, in your experiences, that Maryland is indeed fortunate to have you in these leadership roles. The system of care for children is a concept that's been around over 3 decades now. And one interesting thing, when they look at the effectiveness of system of care and those that succeed and those that don't, one of the key elements is leadership. And so your presence in Maryland, I think, gives all of us hope that we can turn around systems and a system of care that for several years has really been lagging behind. Maryland had maybe 12 years ago a national reputation in the area of children and was held up around the country as a model, did lots of presentations in other states of this is how you do it. For a variety of reasons, that's no longer the case. So we are very hopeful that under your leadership, we can put Maryland back on the map as a role model. You have a room full of families, youth, advocates, providers, all here because they are passionate about this topic, about our kids. We're willing to help in any way we can. And we heard repeatedly from the Lieutenant Governor of the importance of getting those voices involved. Raise your hand if you want to be involved. I think I see lots of hands. All right, we're going to move on to the real questions now, okay? We'll start with Secretary Martin, Special Secretary Martin. I speak for everyone here saying when we were delighted that Governor Moore fulfilled a promise that he shared last year at this event when he announced your appointment as to lead the Children's Cabinet. We want to congratulate you and welcome you. Maryland's cabinet was first created actually in 1987. This is not the first iteration. It's been through multiple iterations in the state. Governor Schaefer was actually the one that initiated the Children's Cabinet. The key role of a Children's Cabinet anywhere in the country, not every state has one, but many do, is the developing and implementing a shared vision for across agencies for improving child and family outcomes. Knowing you've only been on the job a few weeks, and at this early stage, we're interested in your thoughts on developing that and implementing that shared vision across all the agencies here and others that are not here.
Great. Yeah, thank you for that question. Well, I guess I would start by saying, as the Lieutenant Governor mentioned, a big priority for the governor in this legislative session, but also for the Governor's Office for Children, is the Enough Act, which is, and it is a component, not the sole mission of the Governor's Office for Children, and it's certainly not the only component of the governor's agenda in terms of supporting children and families in Maryland. But I think if you look at the Enough Act, it will drive a lot of what the Governor's Office for Children will do. And by that I mean, at its heart, as the governor has described when he's talked about it, it's first and foremost about helping at the community level, helping communities come up with action plans around how to improve their communities across 3 core objectives. One is how can they support the children in that community to unlock their potential. So from how can we ensure that we are surrounding children cradle to career with a continuum of services and supports that enable them to live up to their potential. Objective 2 is how can we build healthy and economically stable families, and in that context, it's both helping families secure good jobs. It's ensuring that they're taking advantage of government programs that can support them, whether that's the healthcare programs that that Laura administers or the programs that Raphael administers, but it's also how can we support entrepreneurs in those communities so families can be both healthy in terms of health care, from mental health care, maternal health care, behavioral health care, but also how can they be economically secure. So looking at the family unit across programs of government. And then the third core objective is how can we build safe and vibrant communities. And in that context, obviously, access to high quality health care, including mental health care, is incredibly important, but looking at things like support for housing, or affordable housing in that community, is working with Vinny and others working on public safety. Does the community need more green space? Are there lights kept on? So taking a comprehensive look on how we can support children, but as the governor has said so eloquently, the best way we can support a child is by ensuring that they have a healthy and economically stable home. The best way we can support those homes is by building safe and vibrant communities. And the best way we can support those is by working across disciplines, across silos, investing in anchor institutions, but investing in community voice. So the people who we're trying to serve, as Raphael mentioned, are part of the solutions that we're trying to drive. So that's a lot. It's a big picture, but it is what's going to be driving the work of my office, and I think driving the cabinet's work across the board, and really focusing on data-driven solutions, listening to people at the community level, and thinking across silos so the total can be greater than the sum of the parts.
Perfect segue. Each of you is challenged to rectify long-standing problems in our child-serving systems at a time when states across the nation are facing looming budgetary challenges, and we have many budgetary and regulatory silos. Each agency has its own regulations, its own budgets, and it poses challenges in service delivery for providers. It poses challenges for families and youth to access services. We're eager to hear from all of you how you will work together to advance a seamless system with no wrong door for families. And we'd like to hear everybody's thoughts, but we do know that I believe it's Secretary Martin has to leave early. Is that correct?
I do.
So maybe would you begin on that question?
Sure, I'm happy to, thanks. I mean, I think that is a major component of the Children's Cabinet mission, so I think we're all committed to working together. And I'd also note that the Children's Cabinet has existed for quite some time, but the governor has worked to re-envision, elevate it within his administration, including adding agencies that historically were not on the Children's Cabinet. For example, the Secretary of Housing and Community Development is sitting on the cabinet because having access to safe, affordable housing, but also all the community development initiatives at that agency are so critical to children in the state. But a big piece of what we'll be working on together is identifying a set of core priorities that we will work across agencies to improve the delivery of services for people in Maryland, but also looking for gaps in services so we can look to secure federal funding or philanthropic funding to fill in the gap. That's the concept for the enough jurisdictions, but really something we'll be looking at across the state. And then I know that the secretaries, and they can speak to it more eloquently than I can, have already been thinking about in terms of benefit access. One of our top tier priorities is to improve access to benefits across the state, no wrong door, making the application something that I worked on quite a bit at the federal level in the Biden administration was how could we find ways to make it easier for states to have automatic eligibility across programs that are available for families living in poverty. So that's will be a big piece of the work that I'll be doing and the Children's Cabinet will be doing, and excited to work with my colleagues on that.
Great. Others would like to?
Sure. I was thinking about something I mentioned earlier when I called loud on my sister. And one of the things that I have the privilege of doing with so many of my colleagues is getting to know them in a very different way. And for those of you who've been in Maryland for a while, you know that DHS and MDH haven't played well in the sandbox together for many years. And that takes some time to turn around. But what you're watching amongst all of us, whether it's Vinny or it's Carmel or it's Carol, is a genuine willingness to get to know each other and to, as the governor said, sweat the details of governing. The untangling we are doing here is profound. And we spend more time with each other on the phone or in meetings or on video than we do with our own families, and that's not an exaggeration. And the reason for that is because in order to make it truly a no wrong door for families, it's recognizing that we have the work to do around centering families, right? Whether it's children or youth or families, and using the data to drive our strategy. The families in each of our departments are the same families but are treated as separate entities. Yes. When we center them and we make ourselves work the bureaucracy versus them, it changes the way in which people can receive true world-class customer service. And that's whether it's on Medicaid redeterminations or in juvenile services or in aging or in disabilities. And so from our perspective at the Department of Human Services, it's really around turning around how do we break down these silos with intentionality. So I want to lift up one example concretely that you're going to hear more about in this legislative session, because the governor listened statewide to the calls for help. Maryland has struggled for nearly 2 decades on what people have called rate reform, which are the organizations, the providers who provide direct care for many of our young people in care, particularly who have complex clinical needs. These are mental health challenges or physical and health challenges. And the governor has proposed in this budget $27 million investment, the first and most historic investment in reimagining how we engage providers to serve kids in care. That cannot happen without my secretary to my left here from health. That cannot happen without working with Secretary Schiraldi. That cannot happen without working across the silos to actually get good work done. And to give you an example of why governing and doing these details matter, in our early estimations when we were pitching our budget to the governor's staff, we believe that implementing rate reform in Maryland for the first time in this significant year ahead, we project that we will be able to have opportunity to draw down $10.5 million in federal funding for direct care cost and $7.6 million in Medicaid reimbursement for clinical services. We can't do that alone, but that almost $18 million was all state general fund dollars because we didn't do the work of governing. And so why I say that is that's about the no wrong door. That's about tearing down these silos that have historically allowed us to make excuses for why we can't get things done. None of it's going to happen overnight. This budget will have to be approved by the legislature, but wanted to lift up a very concrete example of how we've left money on the table that directly impacts our people.
We are looking at a lot of things. First and foremost, since being in the role for a year, we pulled claims data for 21, 22, and now 23 to start mapping out what we're providing, where we're providing it, and to whom we're providing it. So we now know every single service or lack of service that we're providing in the state, so we can really, really be intentional on where we're falling down. And we have a lot of white space in the state of Maryland. One very concrete example is if you're a child or an adolescent with substance use disorder and need an inpatient bed, there is nowhere for you to go in the state of Maryland. You have to go out of state. And I'm really happy to say that we're getting close to bringing that back online in the summer, early fall. And the reason why we knew that is because we had mapped out the whole system. And then we broke it out by race and ethnicity so we could really understand who's getting what services where. The other thing that we're working on, and this is definitely across agencies, is how complicated and convoluted we've made the system. Someone once told me that being able to access our system is a function of affluence and education. And if you don't meet those two criteria, you're not going to be able to get all the way to where you need to get services for your child or family. And so we are systematically looking at all our processes. One in particular is our VPA process that keeps kids stuck in the emergency room for extended periods of time, so we are actively working on that. I know our 1915I is just incredibly, incredibly complicated. We're working on that. So we are systematically looking at where people access care and some of the hurdles that we've put in place and working to break them down. And that includes regulatory changes if we need regulatory changes. That includes statute if we need to change statute. And sometimes it's just urban legend. We've always done it that way. So guess what? We're not going to do it that way anymore. So that's some of the work that we're doing. And I can tell you that I work very closely with both of them on many, many issues, some of which they each touched on, but we're already coordinating in a way that I'm not sure the prior cabinet did.
So I'll say ditto to all of that, and I'll take it in a slightly different direction, which is, as I think back on, so mass incarceration turned 50 last year. Its unofficial start date was Nixon's declaration of the war on drugs, and then the next year, 1973, the prison population grew, and it grew every year for the next several decades, and it was an 8-fold increase in the number of people we were locking up, right? So incredible investment in a solution to a bunch of social issues, and that occurred simultaneous with our withdrawing supports in neighborhoods that were constituted, concentrated poverty. And so income supports went away, blue-collar jobs went away, we made it more expensive to go to college, but we invested a ton of money in correctional facilities. So I get here now, right, and I look at what my department is, and I have 2,100 PINs, right, positions for staff, and about 1,850 kids. I got 2,100 positions and 1,850 kids. The cost per kid per year in one of my facilities ranges from somewhere around $400,000 on the low end to a little over $1 million on the high end. You can come visit my facilities and figure out which is the $1 million one. It kind of looks like the $400,000 one a lot. And so, I have deep concern about that. We need to work across aisles, but I got to get some of the money out of my bureaucracy and into the neighborhoods that people live in a way that honors them and has them imagine, what does safety look like for me? I'm betting they won't say, we need a lot more probation officers and jails. I'm betting they'll say we need jobs, we need places for people to live, we need behavioral health services, we need trauma care for us and our young people. They're going to come up with a lot of better stuff than I'm coming up with in my centralized office. What my centralized office comes up with tends to be, hang on to our pins.
Right.
Because if you give them up, you never really see them again. You kiss them goodbye. They're really gold for
I'll take
bureaucrats.
So louder.
Yeah. So, I've got like 7 levels of supervision between me and a probation officer and 8 levels of supervision between me and a frontline staff member at one of my facilities. So I think resources are really important, but I have to redeploy what I have in ways that leverage best practices, not just think we do it all.
Jane and Edgar, I just want to let you know, in order to get these guys out of here when they need to go, we have about 10 to 15 minutes max left.
That's fine.
Okay.
Great.
Okay, so Secretary Schiraldi, just to kind of piggyback on those comments, obviously we all know that issues surrounding juvenile crime and juvenile services are front and center in Annapolis this year. You can't turn on TV. We've already all acknowledged that. But largely absent from the conversation has been the fact that 2/3 of justice-involved youth have a mental health or substance use condition. So the question is, how can we partner with you to advance an agenda that assures fair and appropriate disposition of criminal justice-involved youth and improve pathways to needed care and services?
Yeah, we have to do that, not just with you, but with each other as well. I don't think we've done yet enough interagency collaboration around our mutual resources. So kids come to me who should really not be with me, but they got left back in the 3rd grade, they got left back in the 8th grade because they had, learning challenges. They feel stupid, they're angry, They don't process, have executive functioning the same way as a kid without those challenges does. And so then they start leaving school, not coming back, hitting the streets and doing that bad stuff. We get them, and sometimes we are identifying, things that should have been identified in the 3rd grade. But by that time, school's poison for the kid. So no, we have 1,500 kids in a state this size. So one thing I will say is that the size of the system has shrunk, and it's shrunk to a number of kids that is smaller than a typical middle school, or about the size of a typical middle school across the whole state. And we should really be able to deploy our resources. So, I don't have a complete and total answer. I kind of like the system of care approach, that we need to have cross agencies so that kids don't matriculate to me, but also get the kind of real meaty services, supports, and opportunities that they need, because they're not in there for sort of sneaking onto the bus and stealing Twinkies out of the grocery store anymore.
Right.
They're kind of in for real stuff. And I understand people's concerns and fears in the community. There was a lot of carjacking. I had 44 kids on my caseload shoot somebody or get shot this year. I ran a probation department for New York City with 30,000 people on it. That didn't happen in a year, right? And so we need very serious help for the young people, deployed in a way that makes sense, follows the data, that is engages in best practices, that takes care of the behavioral health issues, but far more than that, by the way, because just problem-free doesn't mean fully prepared. And so we need to build on their strengths so that they have a hope that they can get a job and finish their education in addition to handling their trauma and their behavioral health issues.
Okay. I'm going to move quickly in the interest of time. Secretary Herrera-Scott, the Behavioral Health Administration recently released a request for technical assistance to assist in developing a comprehensive behavioral health strategy. We were delighted to see this. As I mentioned previously, Maryland's system of care was once a national model that suffered recently in great years. So what are your priorities for this process, and how can stakeholders be meaningfully involved, and what might you have as a timeline?
So as soon as possible, for sure. I think it's some of the things that we've mentioned, to look at our processes and rules and declutter all the steps we have to access services. I think there needs to be some rebalancing in the system. So we put a lot of investments in high acuity services, but not enough investments in upstream resources to really do some of the things that both Raphael and Vinny have said around when kids are in distress, working with them and working with the schools to really understand and address those needs in the beginning. So an absolute rebalancing. I think to all our respective needs, rebalancing not only within our acute services to lower acuity upstream, but even across our agencies. Yeah. And what are the opportunities to bring our dollars together to meet the need? We've talked about, the three of us, foster care, and at least for those children aging out of foster care, combining our respective resources to give them a path forward. We're talking about how do we use our respective systems around eligibility to streamline processes and services. So the technical assistance is, really just basic. We need a behavioral health strategic framework for kids, not little people, but for children and adolescents, that has to be inclusive of the families and the pain and struggles that the families are going through. But then as we think about simplifying that and making sure the services are put in place, how do we fund those services, recognizing that the revenue stream projections don't look great for the state? And I think with some of this rebalancing, we can do it, be budget neutral, but really have a large impact.
Maryland had for many years applied for SAMHSA system of care grants, used those grants to build wraparound, to build rural cares, to to build early childhood, but it's been about 12 years.
Well,
is that on the horizon?
It's definitely on the horizon. I don't know if Dr. Moran said it, where, collaborative care has gone statewide with integrated behavioral health that is inclusive of pediatrics. We're going after every single dollar that's available, but we want to be very intentional on where that money goes and what need it's going to serve, not just sprinkle a little bit everywhere, but really be intentional around where do we need the services, who needs the services the most, and how do we start working with our partners in the communities, including back to what Carmel said around certain zip codes and areas that have historically been underinvested and underserved, and making sure that we level the playing field for everyone.
Perfect.
Okay, so let me continue asking you additional questions in that vein. We know that there's a focus on 988 that was mentioned earlier, and building a well-functioning system of crisis services. It's been a priority for the advocacy community. We know that but what we know is that the unique needs of children have not been well addressed in our crisis system. My personal disclaimer, I ran a crisis program. I was the founding exec for a crisis program that I ran for 28 and a half years. But it was an adult system. So the question is, how are youth needs being addressed in planning that's underway, and where are the opportunities to participate?
So we are working certainly with our crisis partners and our partners that provide crisis services. Some of the limitations are the workforce. We certainly heard that over and over again around having the expertise to address children and their families. But it's first and foremost, and it's certainly a priority. We had RFAs go out to fund the crisis services, and not all of the crisis teams are ready to go with providing comprehensive services for children. But we are trying to understand what the issues are and then working with them to help identify workforce, add additional resources if we need it. But we are absolutely committed to making sure that our crisis stabilization centers and our mobile crisis teams can serve family and children and their families.
And just the last point, you know as well as I do that boarding of children with behavioral health crises in emergency departments is a huge problem. And so there's the question about why haven't we developed alternatives like residential crisis beds for children and youth. Other states have them. We don't. So we really need to look at, expanding our alternatives while building the system out.
So we have actually brought more inpatient beds online for children. And, we certainly want to serve our kids in the least restrictive settings. So we have brought them on, but the beds are not coming on fast enough. And to the point that I mentioned, there's a VPA process or a process that helps pay for the services for kids that need. It's just a very complicated process that covers both our agencies, DHS and MDH. And so we're working on the rules and our state statutes and our state regulations that make it as complex as it is, and we're working to simplify that process together.
I just want to chime in on something. I see my friend Jim McComb back there, and Jim and I have been talking about this issue because from my standpoint, I got kids in my detention facilities waiting to go to group homes, right? And so the tendency there is to run out and get group homes. And we probably could use some more group homes, but there's a bunch of kids in those group homes that I think could be home at wraparound services. So before I scramble and buy a bunch of buildings, because once you buy the buildings, you kind of, you just get drawn to them, and then people get an edifice complex. The kid's got to be in a building in order for something good to be happening.
If you build it, they will come.
I'd like to build on this, and then this has to be, we have to leave. We have to go join the governor. So let me just say one thing related to this, though.
Please. So
I want to answer Secretary Schiraldi's question. We do not need more group homes in Maryland. I'm going to say that right now. And so let me dispel a myth that has come to be normal in this state that is not based in fact. Since we began this administration, the three of us in particular are tracking daily how many kids are in hospital overstays and in hotels. And let me say two things very clearly based on international research. This is not Rafael's opinion, right? A hotel or a hospital is not a placement. So saying that in this state should no longer continue. That is not a placement for a child.
Absolutely.
Of the 3,792 children in care today, pretty much in the last couple of months, there's been, from the DHS side, between 10 and 15 children in hospital overstays. 10 to 15, that is 10 to 15 too much of the 3,792. I know exactly which kids are in which hotels in which counties in the state of Maryland. It shouldn't be rocket science for us to know that. Similarly, the three of us in our departments and our teams meet regularly to better understand how to better manage the care of the kids that are present in either hospital overstays or are currently in a hotel. Why? Because in many of those cases, some of them have very complex mental and clinical needs. They shouldn't have been there in the first place. Right. And the rejection of many of those kids, oftentimes, though not always, from some of our providers, will not continue in this state. Why I'm saying that publicly is because we have to accept a new normal, which is that if we invest early and often in a family when the crisis is happening, they will not have to be in a group home necessarily, not always. But the international research tells us that the least restrictive setting is the right thing to do for children. And if we invest in the 0 to 5-year-old children, when a human's brain is developing the most, the neurons and the connections to family, we won't need them later on in our system. That's where we should head. With that said, thank you for your service and have a wonderful evening.
Thank you very much. We appreciate your comments and